Hello and namaste to all beautiful yogis. Today we are going to talk about the relief from sciatic pain. Now, sciatic pain or tenderness is experienced along the sciatic nerve of the body. This nerve is the largest nerve of the body and it originates from the nerve roots that are exiting the spinal cord. It passes through the deep buttock muscles, through the back of the thigh, outer edges of your leg and to your foot. Now, sciatic pain can be experienced due to many reasons. However, two main reasons that we know of are disc problems and piriformis syndrome. Now, disc problems can be caused due to your disc bulge or disc herniation, whereas piriformis syndrome is when your muscles of the hip, your buttock muscles are tightened, and because of that, the sciatic nerve gets pinched. This is very common amongst many people. Now, the yoga postures that we are going to do today are going to benefit you in both the cases. However, it is advisable to check with your doctor which kind of sciatica are you facing. Is it due to the disc problem or is it due to the piriformis syndrome? So let's begin. We start with cat and cow pose. So inhaling from the lower back, arching your back, looking up, exhaling. Again, the movement is beginning from the lower back. Inhale and exhale. Inhale and exhale. Inhale and exhale. Inhale and exhale. You take the right leg forward, bring the leg in between your palms. Keep pushing your hip forward. Fingertips are on the floor. Take the back leg further behind. If you're here, it's okay. The only movement that is needed is pushing the hip forward. So stay here and breathe. You can point the toes back. Keep looking in front. Stay and breathe. Few more breaths. This posture realigns your spine. Continue to breathe. And gently release. Take the leg back. Bring the other leg forward. So the left leg comes in front this time. Pushing the right knee behind, staying on the top of the knee. So this portion of the knee is down. Stay here and breathe. Point the toes back. Keep pressing the toes down. Keep lifting the chest up. And breathe. Deep inhalation, deep exhalation. And release. From there, bring your right knee forward. So the knee comes next to your right hand and you're taking your hip further behind. If your right leg, right side comes down on the floor, it's all right, but your pelvis should stay in the center. If it doesn't, you can use a book to keep underneath your thigh, like so. Yeah? Book or a bolster or a small cushion, anything will work. Stay here and breathe. Keep your toes flexed. Keep the back toes pointed. Stay and breathe. Keep the chest lifted up. You will feel a stretch on the outer side of your right thigh. Stay with that stretch. You can stay higher if you need to, like so. And at the end, tuck your toes in. Lift the other leg off, coming into tabletop again on all fours. This time bringing your left leg forward, taking the right leg back, sitting back again for Pigeon Pose, Ekpada Rajakapotasana or Pigeon Pose. Stay here and breathe. You can try to keep moving the hip down, but don't sit on one side. Stay in the center. Continue to breathe. You can stay higher. Comfortable position. And from there, in the back knee in, take the leg back. Coming up. From here, extend your legs in front. Now, for sciatic pain, it is not advisable to bend forward at any given point in time. So we'll keep the legs straight here, and you're going to try to sit straight, lifting the chest up. You can use your arms to lift up. Imagine there's a wall against your feet and your feet are pressing against the wall. The modification would be you can keep your knees bent, still keeping the toes tucked and staying here. What you should not be doing is going here. Yes? Do not go here. Do not load your lower back. If you cannot sit straight, keep your knees bent and do the same stretch. If you can stay here without any support, you can bring the arms by the sides. But if you need the support, use your arms. Lift up and stay. Continue to breathe. Enjoy the opening of the chest. And the stretch, slight stretch in the back of the legs. For the next posture, you will bring the right knee over the left knee. You can lift your hips slightly, placing a blanket or a bolster underneath, or even a big book would do. Right knee over the left knee, keeping the left foot straightened up. Stay here. You can bend forward ever so gently. Stay and breathe. Inhale and come up. Release the foot, shake your legs out. Change sides. So this time, left knee comes over the right knee. Make space for yourself. Left knee over the right knee, right toes pointed up, left toes pointing back. Stay here. Bend slightly forward, just slightly. You can even just sit here. Stay and breathe. Big exhalation, big inhalation. Inhale and come up. Release, shake your legs out. From there, taking your left foot outside of the right knee. Now, this is only the modified version. For the full version, you can fold your leg. If you can sit, do this only if you can sit on both the hips. If you need to elevate your hip, use a bolster, use blankets, whatever you need. Otherwise, stay here. Keep pulling the knee towards you. Keep the leg pointing up. If you're very comfortable, you can take the leg behind. Sit on both the hips. Sitting bones. Twist as much as you can and just stay here. Continue to breathe. You can lengthen the spine more using your palm. Keep twisting. Look towards the side or look back if you can. Breathe deeply and fully. And release. Changing the sides to the other side. So folding my right leg underneath, left leg goes over, or you can keep the right leg straight, hugging the knee to the chest. You can stay here, you can choose to stay here if this is enough for you. If you can, twist fully and look behind. And very gently release. Extend your legs out. Shake your legs out. We're going over. Coming up for Sphinx Pose. So bringing the elbows underneath your shoulders. No stress on the lower back. See that you're pulling the abdomen in. Palms are pressing down. Forearms are pressing down, so that you're lifting the belly off the floor slightly. Pubic bone is pressing down towards the floor. Legs are pointing back and extending behind. Stay here and breathe. Keep pulling your abdomen in. Once you're done, rest in Crocodile Pose or Makarasana. You can repeat the same posture, or you can go for the full version, Cobra Pose. Lifting up as much as your body allows you. You can keep the arms slightly forward for better support. Lift up, stay here and breathe. Keep rolling the shoulders behind. Keep your feet together if possible. If not, keep them hip width apart. Stay here and breathe. You're still pulling the abdomen in. You can stay lower. And gently come down. Release. Rest in Crocodile Pose. Rolling over onto your back. You do leg raises, one leg at a time. Now raise the leg only as much as your body allows you. Keep the leg as straight as possible. So if you need to bend your knees, do so. Otherwise, go straight. 1, 2. You can go slower. 3, 4, 5. On the last one, hug your knee into the chest. Keep pulling the knee into the chest. Point the toes. Breathe here. Leave the knee here. Take your arms behind or by the sides. If you have space, take them by the sides, the shoulder level. Exhale. Take the leg towards the other side. Look towards your right side. Inhale, center. Exhale. Inhale. Exhale. Inhale. 4. Inhale. And 5. And come back. Release the leg. Arms by the sides. Let's do the other side. You can place the palms on your hip just to see if your hips are leveled. Otherwise, keeping the right leg straight, left leg goes up this time as much as your body allows you. If you're using a strap or a dupatta or a belt, you choose to use that, right? 1, 2, 3, 4 and 5. Last one, bring the knee towards the chest. Point the toes, keep breathing. From there, arms by the sides, exhaling, twist towards the right and center. Exhale, inhale, and 3, and back, and 4, and back, 5, and back. And extend the legs out, arms by the sides. Again, a passive stretch for your inner thighs, which will be just here, keeping your legs here. No pressure. The moment you sit up in proper Baddha Kona Asana, there's a lot of pressure on your inner thighs and they become active. If you're lying down here, there is absolutely no pressure. You can support your legs with bolsters or with pillows. Keep bricks under your knees if you need to. Stay here for a few breaths. And gently release into Shavasana as and when you're ready. If you're still experiencing pain, you can choose to bring a pillow underneath your knees and still keep them bent. I'm choosing to keep the knees bent here. And that completes our practice for the sciatic nerve pain relief. I hope you have some relief with these postures. Yet again, I would like to emphasize, please consult your doctor before beginning any of the exercises. If you like this video, please leave a big thumbs up and please subscribe to my channel. Thank you so much. See you in the next video. Namaste.